This is a special report from KRBC, Abilene's First News.
Good evening. We're here on the grounds of Hendrick Medical Center, and what you're about to see tonight is a look into the future. It's an expansion that will affect the entire Abilene community and its surrounding areas, an expansion that will affect you. But before we get there, we begin with a look back at a very rich historical past. In the early 1920s, it started as dreams and prayers to build a hospital for those who were sick and suffering in Abilene, an institution rooted in Christian values. Inspired by the vision of Reverend Millard A. Jenkins, in 1924 that vision became a reality. The hospital would be called West Texas Baptist Sanitarium, and it would be the beginning of a healthcare system committed to the people it served. In the 1930s, the hospital, along with the rest of the country, fell into hard times, struggling to survive through a depression. It was the generosity of a man named T.G. Hendrick, a local oil man, that ultimately saved the hospital. Fittingly, in 1936, the hospital was renamed Hendrick Memorial Hospital. In the 1940s, and now back on track financially, the hospital was facing new challenges. Camp Barkley brought new growth to Abilene, and with it, a post-war baby boom, a boom that doubled the size of the maternity ward to meet the needs of the community. Also of great significance during this time, the onset of polio. Students at the School of Nursing used a machine called the iron lung, a device that helped patients breathe, and an instrument at that time that helped to save lives. By the 1950s, a new element was introduced to Abilene, Dyess Air Force Base, and with it the need for even more hospital services and equipment, a sign of the times yet to come. In the 1960s, the key word was expansion. An X-ray department, the Anderson Wing, named in honor of Minnie Anderson, provided over 80 new rooms, an emergency room, new staff offices, and a clinical lab. The 60s also brought the addition of a children's hospital, a blood bank, and more space for the nursing school. It was at this school that a young student began a nursing career that would span more than 3 decades and counting.
This is me.
Her name, Tamara Lutke.
I chose Hendrick because at that time, as it is now, I believed it to be the best hospital to work at.
The history of Hendrick Memorial Hospital could not be told without the people who have been so much a part of its history. Lutke's 39-year career is a powerful testament to the dedication and commitment to excellence Hendrick has instilled in its employees, a driving force in her eyes that has kept her here for so long.
I stay here because this is my family. There have been lots of changes, a lot of additions to the building, and I love what we're doing and what we've done in the past with the building, but it's the people I work with and the patients and the physicians that keep me here.
The mission of Hendrick Memorial Hospital is clear: integrity, teamwork, quality, and compassion, values that have carried the hospital through its more than 80-year existence.
To me, Hendrick is, and what I do here, is a huge part of who I am. And I think that's part of what that means. We are Hendrick, we are one big team. I'm really proud. I'm really proud that we have been able to grow our services to meet the needs of the community. I'm really proud of the work we do here, and I am very proud I work here.
Throughout the 1970s, 80s, and 90s, the hospital maintained a level of excellence through its leadership. E.M. Collier, Boone Powell Jr., and Michael C. Waters, all at the helm of a dynamic healthcare system.
I want to say something corny like it's the hospital with a heart, you know, because that's the way I feel. It's bringing people together that really fit, that really have the same values and the same sense of mission that makes this work for us.
For nurses like Tamara Lutke, even after 39 years, this journey is still an adventure.
I feel this has never been just a job to me, and you'll never hear me say I'm just a nurse. We make a huge contribution to the quality of care and to patients' lives. And nurses make a difference every day in someone's life.
The possibilities, endless.
How could you feel any better about anything? And to me, and as to many other nurses, this was my mission. I was called to do this.
And the future, inevitable.
The Project 2010, I think, is going to be awesome. It is home. They'd have to drag me out of here.
You have taken a look at Hendrick in the early days through today. Coming up, what lies ahead for the future when we come back.